for the modest weight loss, 2 to 5% of the body weight over 6 months. Apps are more effective when paired with the behavioral therapy and professional support. That is that more effective when paired with the behavioral therapy and professional support. Long-term adherence and the user engagements are the critical for the success. These are all some of the studies. 6 months data are available. This is done in the Australian study. This is one of a US study which shows a significant modest weight loss of up to 8% over a period of 6 months data. So coming to the final features of the weight loss app, self-monitoring of the diet and personalized menu, which is really helpful for many of the persons, self-monitoring of exercises and goal setting, that is that realistic goal setting, time frame, feedback on the daily activities, daily reminders, personalized and AI-driven advice, and health-related text messages or call from the providers. And to conclude that app-based weight loss programs can be a useful tool for most of the individual, but they are not the one size fits all the solution. That is that success depends on the factors like users engagement, app features and individual circumstances. It is important to choose an app that aligns with your needs, goals, and consider combining it with other healthy lifestyle strategies and professional guidelines. That is that just looking on the app is not useful. We have to work it out along with that our professional guidance. So these are the futures. If in future, the last one is the digital therapeutics. FDA approved app-based treatments are upcoming mode of treatment. So definitely these app-based treatments effective in not only in obesity, in healthcare sector itself. So finally, the best motivational example for these activity apps is our moderator only, who regularly uses these health apps, and such a for example of this clear example of this fit person is that our moderator Dr. Srinivasan, who regularly uses these kind of apps and regularly upload it, and in the WhatsApp status, it's clearly he is a motivational for everyone. Thank you everyone.
And it is to say it is hype. It is going to be Dr. Prem Kumar.
Very good morning to all, and I extremely thank Dr. Venkatesan for talking on my behalf. And he told that short-term data are there, no data beyond 6 months, and it's modest efficacy, 5 to 6% weight loss. But he failed to mention the cost associated for each 1 kg of weight, which is lost with this app. Can I have my slides, please? Yeah. So topic is actually weight loss app in diabetes care. So he told it gives a lot of hope. That means it's efficacious, and I would like to differ from it. I would like to move motion. It's hyped. It's overhyped than what actually it is, and it's misleading in many cases. So these are my rebuttals. It's basically money, money, and money. Presently, it worth $4.5 billion. In 5 years, the worth of this weight loss app will be $7.8 billion. That's the thing. So it's basically money, and money makes them to do lot of advertisement and lot of things, attractive things, and get as many users as possible in a short period of time, because after 6 months, 1 year, they go away and away. Another thing, new app comes. So these are the widely used apps. MyFitnessPal, Noom, Weight Watchers, and all these are paid app. So if you tell any efficacious weight up, it's paid, right? None of them are free. So of course, some of them are free, but most of them are paid apps. These are their claims. They say it's AI-driven. They give personalized coaching, and they say that they modify the behavior. Let's see whether it's actually true or not. So the reality is, most of the apps, in fact, none of them are recommended by any guideline. That we should say, because we practice evidence-based medicine, and we should say what the guidelines says. And they are minimally validated. Very few apps like Noom are validated in studies and published in peer-reviewed journals, and they lack evidence-based efficacy. The efficacy is modest. It's not like great. And their target audience is often healthy obese people, not obese people with comorbidities. In obesity with diabetes, obesity with hypertension, obesity, OSA, data is not there with these apps, right? So, and they lack supervision from the medical team. Of course, there is one doctor, namesake, he doesn't interfere in the proceedings of that app because he is just for to show that one doctor is there in the app, that's all. And publication, this is a publication from Lancet which shows they promote unsustainable, harmful activities. There are more bad than good what we can see from the survey that was done. And they promote fad diet, quick fixes, ketogenic diet, they promote rapid weight loss, and they also lead to complications, like say a patient with obesity and diabetes uses this app. They have not told about the adjustment of medication. He is vulnerable to hyperglycemia, precipitation of ketosis, anything can be there. So basically they target short-term outcomes. Long-term plan is not there with these apps. And personalized medical history and examination is lacking with this app. They ask, of course, whether you have diabetes, hypertension, but other things are lacking. So no personalized evaluation of a patient when they are included, and vitals are not being monitored regularly. Blood tests are not run in most of the apps, and drug-to-drug interaction, especially in diabetes, hypertension, obesity, this issue is not addressed at all with these apps. And they promote eating disorders. Many people with obesity have got borderline personality disorder. They are very vulnerable for eating disorder like anorexia nervosa. They promote a concept called as thinnification. And they get obsessed with eating, clean eating, and orthorexia is the terminology for that. And people, when they develop eating disorder, nobody monitors it. It goes unnoticed and leads to complication, metabolic complications, psychological, and amenorrhea and other things, bone health. And they lead to overemphasis on calorie counting. They don't talk about the quality of food. It's only calories, and how much calorie you take. And nutritional value doesn't have any place. They don't take into account the insulin resistance of the patient and also BMR of the patient. And they promote this type of phenomenon, yo-yo eating. You go for a crash diet, you reduce your calories, rapid weight loss you achieve, the weight loss plateaus, you go back to the old eating, you gain weight. The yo-yo dieting is very common with these apps. And they promote short-term weight loss, not long-term weight loss. What we need is long-term weight loss. And if you look at this data, long-term studies, more than 80% dropout is there with these apps. And maintenance algorithm are defective. They lack human empathy, all these algorithms, and they give them a false sense of progress. And behavioral therapy is not actually what they claim, doesn't happen. And there are many ethical issues when it comes to app. A person comes and asks you, doctor, can I use this app? What will happen if you say yes? Let's see. See, there is conflict of interest. There is one app called as MyFitnessPal. It includes doctor nowadays, and it advocates GLP-1 therapy. So there is a conflict of interest. They use your name, they initiate them on GLP-1 therapies. Okay, so the patient may not need it, patient develops some complications. That is like you will be penalized for it. And data privacy is not that. You expose your patient data to a private company, it can anytime it can be sold. Yeah, and you know about the Meta and Facebook. They are facing a lot of lawsuits because of the data theft that has happened. Even MyFitnessPal, the data has been recently hacked. More than 150 million users' data were been hacked. Right? So, these are the things you should remember. And misinformation. Many people can post anything on weight loss. You are answerable. So misinformation that happens in this app, the doctor is responsible. Patient will ask you, you told this app, they told this, I did this, this happened. You are penalized. So you are liable for your reference to these labs, and you should be very much concerned. And ethical and psychological things are there. So I have time? Yeah. Okay. It encourages extreme dieting, which goes unmonitored, and no mental health screening is done for these apps. Main thing is validation, whether these apps are clinically validated. The results, whether these results are biased or it's overinflated. These are the questions. Only few RCTs are there with the labs, but long-term studies are very, very few. Even in long-term studies, the efficacy is modest. No, data is not there beyond 1 year of usage. Most of the claims and weight loss, their placebo effects are over-elated responses by, because they don't any body to say that the patient actually lost 10 kg. So there are many biases in reporting with these apps. So inconsistent results with respect to many apps, and they are involved in influential marketing. What is influential marketing? Let's see. They say 10 kg weight loss in 2 weeks. We have AI powered and we do 100% guarantee. And they will say that this particular celebrity is using this. They use the celebrity name to promote the app. This is called as influential marketing. Then a lot of scams are going with these apps, and they promote many placebo products, saying that it's a miracle cure. And nobody can question them. You use it, you don't lose weight, nobody can refund it. And they also have a subscription trap, because they have auto refund. They take your number and every month your money is debited. And cancellation very difficult with these apps. And initially they say it's free, but only the basic features are free. But all the other things, they come under the premium category. So there is no other way that you have to pay and get everything done. Yeah, and no refunding. It targets people who are emotionally labile and they use it. And it's not culturally sensitive. They promote Western diet in these apps, and they assume that everybody has got uniform access to all the food. But we know about the socio-economic power for people. Some people only can afford those foods. Not everybody can purchase a protein powder. And yeah, and no customization when it comes to religion or culture. And they also give a false hope of empowerment. Just because you check your weight daily and blood pressure, everything, doesn't mean that you are going to have a long-term change in your behavior. And over-reliance on techs. Only tech savvies can use it, not all people. And even this one language thing is not there. It's not there in Tamil and other national languages, state languages, and no accountability. They promote weight loss as a game, what we call as a gamification. They give you some thing to target, you do this, you do this. So gamification is what is happening. And short-term fixes doesn't address the main cause of obesity, stress, sleeplessness, depression. They don't address this. Yeah. So to conclude, sorry for taking time, app-based weight loss lack medical vigor. And there are a lot of ethical issues, psychological issues, and scientific issues in that. Risk outweigh benefit. That's what I want to say. And health professional initiated weight loss is the need of the hour, and they are better than these apps. Thank you.
Giving us an excellent view about the app-based weight loss for and against. Now I'm going to have a neutral view on this. And as you all know, the common reasons of diabetes is sedentary lifestyle, overweight, and high-fat cholesterol diet. This is unpreventable. Now we have, our lifestyle has changed completely in these recent days, and we are more sedentary. I am in the 3rd floor now in the hospital, and I try to take steps all the time, most of the time. And whenever I ask my patient, young or old or anybody, they say they stand in a queue and take a lift. So we are more sedentary now, and this is looking like a habit now. And when you ask a young person with diabetes why he has not done anything, or why did he develop diabetes at young age, he says it runs in the family. So it is because nobody runs in the family. You see everyone big in the whole family. And even though there is lifestyle genes there, lifestyle plays another important role in development of diabetes. And 1 in 4 people lead a sedentary lifestyle, especially young people now having IT job, sits there and 12 hours in a chair without moving. And if they are doing a home work from home, probably they don't move at all. And lifestyle modification definitely improves the blood glucose. If they lose weight, you see they can reverse diabetes. Physical activity, healthy eating, stress management, and blood sugar monitoring all helps in controlling the blood sugar and reduce obesity. Joining gym, if whenever you ask a patient, have you started doing physical activity, they say, no, I have just joined gym. Joining gym is not only thing which will make them lose weight. The gyms, as Dr. Prem said, it is not the apps alone. The gyms also give attractive, offers. They